to Soda City Living. This is a lifestyle show focusing on the best things to see, eat, and experience all around the Midlands. Many times we're out and about having fun in the Soda City and beyond, and we'll get to a fun activity in just a bit. But first, health is an important part of any lifestyle. Today we're focusing on medical procedures offered at Palmetto Bone and Joint. Dr. James Logging specializes in hip and knee replacements and says that new ways of doing those procedures cut down on pain and recovery time. Here's more. Joint replacement surgeries are common procedures that many people may need, especially as we age, and I'm excited to introduce you to Dr. James Logging from Palmetto Bone and Joint. Thanks so much for being here.
Thanks for having me.
So tell us a little bit about your practice.
Yep, so Palmetto Bone and Joint, we have 3 different locations. Our closest one being in Chapin, South Carolina, which we just opened in 2018. We have a cutting-edge outpatient surgery center there so that we can provide basically just the highest quality of orthopedic care to patients in the Midlands and upstate of South Carolina.
And what do you specialize in?
So yeah, the main thing that I specialize in, probably 95%, is hip and knee replacement. And I pride myself on being able to offer some unique techniques for those procedures that really help patients with their recovery. We're
going to dig into one of those in more detail next time, but tell us just basically the alternative for hip and the alternative for knee, what those entail.
Correct. So for hip replacement, typically people have surgeons do what's called a posterior approach, where they come from the back part of the hip and they cut through all the muscle. Mm-hmm. So it's very traumatic. It makes the recovery take a lot longer. So when I started practice 18 years ago, I started doing what's called an anterior approach. It's really hard to learn how to do it well, so there's very few people who do it still, even today. But it makes a huge difference in the recovery just because we're not violating that muscle or damaging the muscle. So they get recoveries a lot quicker, but they also get more normal function of their hip afterwards.
Right.
And then for the knee replacement, typically people will do an incision where they go and they cut into the tendon, the quad tendon. And that's pretty traumatic, but that's typically just the way that it's been done. But now there's a Jiffy knee technique where you come more from the inside part of the knee. So you avoid that muscle and tendon altogether. And then, again, just like with the hip, not violating the muscle, it makes a huge difference in the recovery and in pain afterwards.
Mm-hmm. So for your patients who are coming in for these procedures, what are a lot of the symptoms that they're feeling?
Yep. So typically pain is probably the most common thing. Obviously stiffness, swelling, limited mobility. Patients, sometimes the joints will start to give way on them, so they'll just be walking and then their leg gives way and they fall. And so those are the most common things, but pain is probably the biggest factor that drives patients to having joint replacement.
So tell us about downtime with the surgeries. When people think about joint replacement, they think, I'm going to be out for a good part of the year.
Right, and that's the nice thing with these new approaches for helping with the recovery. The recovery is actually pretty quick, and so these patients are able to get up and they're walking the day of surgery. So we do a lot of them at our outpatient surgery center, so patients are able to have the surgery done and then go home the same day, which a lot of patients like.
Yes, and that's very surprising too. You maybe wouldn't think that, when you think I'm going to get my knee replaced or going to get my hip replaced,
yeah.
You'd be surprised.
Yeah, exactly. Yeah, most people would prefer to go home. They're more comfortable in their home. We have therapy usually come out to the house to work with them, to make it easier for them. But they just like that. Plus, it's nice to avoid the hospitals. That's where sick people are. And so there's a lot of reasons to avoid that. But so the outpatient surgery center has been great. Patients really like it and feel like they really get a good response with that.
So if a person's having problems with their joints, when should they know to come in and see you?
Yeah, so usually what I tell people is, if you're getting to where your lifestyle is being affected, you can't do the things that you want to do, and the pain is just getting pretty much unrelenting, you shouldn't continue to suffer with it. A lot of people will just kind of put up with it and deal with it, but you don't have to do that. It's okay to come and get help, and the recovery is much better, so it's not something to be feared as much as what it was in the past.
What do you love about what you do?
Yep. So the biggest thing is I love helping people. And so, patients come in, their quality of life's affected, they're in pain, and they're just not happy with where they are. And then we're able to change that. So we basically give them their life back, take that pain away, and allow them to be active again. And so that makes a big difference, just not for their life, but also for their health overall as well.
Tell us about the team that you work with.
Yep, so we have a great team. I have a physician's assistant, Victoria, who works with me, who's very awesome. And then our surgery center team and office staff are just great. We all seem to work together really well. And so that just provides a better care for the patients because it's more streamlined.
If someone's interested in becoming a patient, do they need to call or do they need a referral? How does that work?
Yep, so typically unless insurance requires a referral, usually we don't require one. So patients can just call and make the appointment themselves. You can go online and submit a request through the website, and then the office staff will call them and schedule those patients for the appointments.
And when a patient comes in for the first time, what do you think their experience is like? What do you want it to be like?
Yeah, so I want it to be a positive experience. You know, I want them to feel comfortable and safe, and also realize that we're there to help them, and that they're getting better is our number one priority.
Well, thanks so much for being here today and giving us a general idea of who you are, what you do, and what you specialize in. And I can't wait to get into that a little bit more next time, specifically talking about the Jiffy knee procedure and also talking to one of your patients who has had that done.
That's right.
Thanks for being here.
Thank you so much.
We'll be right back.